What's going on, guys? Tony Maritato here, physical therapist, and in this video I want to talk to you about the mandatory claim submission law, how that works with cash-based providers who are thinking about treating Medicare beneficiaries specifically for covered services. There's a lot of confusion, there's a lot of misinformation out there, so I'm going to do my best to point you guys toward the resources that I think will help you the most. First, start with this article. Now, this article was originally directed to me by Nancy Beckley. Nancy Beckley is my go-to expert for anything related to compliance, Medicare regulation. She is by far the leader in the industry. But basically what this is a published article by Mary DeLong. It was released November 2018. There's information in here regarding the mandatory claim submission law, the opt-out provider list, who can opt out. Obviously, PT, OT, SLP cannot opt out. If you guys watch to the end of this video, I'll take you through the CMS Medicare Benefit Policy Manual, where I'll show you where the rest of this information is. But just suffice it to say, we are not opt-out providers, which limits us in terms of being able to provide certain services to Medicare beneficiaries. This section of the article talks about being a contracted non-par provider. As a contracted non-par provider, you are able to charge the Medicare beneficiary up to 115% of the non-par allowed amount. The non-par allowed amount is 95% of the par allowed amount. But I'm going to tell you, I could do a whole video just on that because it opens up a whole new can of worms. I certainly don't advise any of the providers to go non-par unless they fully understand the position they're going to be in. The increase in collections, in my experience, just has not been worth some of the frustration. This is the part that I want to focus on. So the exception. There is an exception to the mandatory claim submission provision, but it isn't as a result of HIPAA's patient rights as many individuals believe. So there's a part inside the CMS Medicare Benefit Policy Manual, Section 40, where they talk about the patient having the right to refuse to allow you, the provider, to submit a claim on their behalf. Let's keep reading here. It is a Medicare provider-specific patient right, which allows the beneficiary legal representative to, of his or her own free will, or of course their authorized representative. It allows them to refuse to authorize the submission of a claim to Medicare if the provider is enrolled in the program. Okay, if the provider is enrolled in the program. You basically have three situations. You can be a contracted participating provider. You could be a contracted non-participating provider, or you cannot be enrolled in the Medicare program, not contracted. The first two situations, you're signing a contract, you have responsibilities, you're attesting to certain requirements. In the other option, you're completely unaffiliated with Medicare. So the HIPAA patient rights specific to restriction of protected health information, PHI, is the option to request that a covered entity, healthcare provider, not disclose PHI to the health plan. Okay, makes sense. That right is preempted by the mandatory claim submission requirements, as noted in this section, which stipulates, quote, if a provider is required by state or other law, for example, the mandatory claim submission, to submit a claim to a health plan for covered service provided to the individual, there is no exception or procedure for individuals wishing to pay out of pocket for the service. Then the disclosure is required by law and is an exception to the individual's right to request a restriction to the health plan pursuant to that section. So what does that mean? Okay, basically what they're saying is that if you're required by federal law, which we are, the mandatory claim submission law is a federal law. If you're required by federal law to submit a claim to, in this case, Medicare as the payer, the patient loses the right to tell you that you're not allowed to submit that claim. I always kind of make the comparison, and maybe it's not the best one. If a patient tells me I'm allowed to rob a bank, I'm still not allowed to rob a bank, right? If the patient tells me I'm allowed to steal their car, even though it's their car, I'm still not allowed to steal their car. So the patient cannot authorize you to violate the federal law because the federal law supersedes the Medicare stipulation. Now, let's jump into, I'm going to do a quick Google search, CMS Chapter 15. We're going to go into the Medicare Benefit Policy Manual. We're going to go down here to Section 40. And what we're looking at, I'm going to zoom in here for you guys. Couple of things. So the first thing to me that I just say, you know what, this to me just kills any opportunity anyway. The only stipulation in which a non-opt-out physician, practitioner, or supplier are not required to submit claims to Medicare for covered services is when a beneficiary or their legal representative refuses of his or her own free will to authorize the submission of a bill to Medicare. Okay, so a lot of people will take that sentence and say, oh, well, if they refuse, then I'm allowed. We just saw in the previous article that it doesn't matter. Even if they refuse, that right does not overturn the federal law. But even if it did, however, the limits on what the physician, practitioner, or supplier may collect from the beneficiary continue to apply to charges for covered services. This is an important set of words, covered services, notwithstanding the absence of a claim. So even if you believe that you did have the right to treat a Medicare beneficiary while you have no affiliation to Medicare, and you believe the patient has the right to say, no, you're not allowed to submit my information to Medicare, you're still not allowed to charge or collect more than the limiting charge that Medicare allows. So with that, why would you even bother? The whole reason cash physical therapists want to treat Medicare beneficiaries and charge their cash rate certainly is because it's higher than the Medicare allowed amount. And I understand it's far more expensive to deliver the level of service that you're delivering. So it's fine. It's totally justified. $150, $200, $250, whatever it is you charge, totally reasonable. But the law, the law is not on your side. The professionals, the experts are not on your side. This is a situation where I would absolutely just defer and say, hey, either I'm going to contract with Medicare, I'm going to learn the guidelines, the regulations. Now, of course, I'm biased to that because I teach the Medicare billing course. I teach zero to paid, and I've helped hundreds of therapists join the Medicare program. And once they've joined, they've realized just how transparent and easy it is to follow the Medicare guidelines. But that being said, if you still want to maintain your independence from any third-party payers, and if you still want to work with Medicare beneficiaries, the key words to understand is this is only related to covered services. So if you have a Medicare beneficiary who might have some shoulder pain and wants to do golf performance is not a covered service. If you have a Medicare beneficiary who wants to hire you for certain modalities that are never covered, for example, dry needling is never a covered service, you're welcome to do that on a cash basis. Personal training, there are so many things that we can do within our scope as PTs, OTs, and SLPs that are beyond the scope of covered services as according to Medicare guidelines, but are within the scope of our Practice Act and what we know and do really well, that I would say that I would not put yourself at risk. I would not put yourself in a position of compromise. So guys, I'm going to post the link to that article in the video description. I'll post the link to this document in the video description. If you need more information about this, do what I do. Reach out to Nancy Beckley, hire the expert, the best in the country, and let her guide you because this isn't the kind of stuff that you want to mess around with. Guys, I hope that was helpful. I'll catch you on the next video.